I am Dr. Alim Akhtar Bhuiyan. I am Senior Consultant and Coordinator of the Department of Neurology at Apollo Hospitals, Dhaka. Today we will be discussing regarding dementia. This is a very important neurological disease, and it is basically a number of brain disorders which causes progressive memory loss and other cognitive dysfunction, and also it slowly worsens activities of daily living. Most important part is that the consciousness of the patient should be preserved, and it is as opposed to delirium when patient is in acute confusional state. Uh, Delirium can be reversed by treating the condition which cause the delirium. But dementia is progressive. Most of the dementias cannot be reverted back. It is rather progressive. If you look at our brain is composed of billions of cells. To be exact, more than 600 billion cells make up our brain, and it is composed of more than 400 trillion connections or synapses. The different part of the brain is responsible for doing different functions. For example, the vision, the language function like understanding of language, expression of language, higher executive function, motor system, the sensory system, walking and balance, etc. These are done by different parts of the brain. In dementia, there are few functions which are affected. First is the cognitive impairment. So it causes difficulties with memory, language, attention, thinking, orientation, calculation, and problem solving. And in dementia, there can be other features also like psychiatric or behavioral disturbance. So there is change in personality, emotional control, social behavior, depression, agitation, hallucination, and delusion. And also it affects activities of daily living like eating, grooming, bathing, dressing, shopping, driving, etc. So different faculties are affected in dementia. What is MCI? Mild cognitive impairment. If you look at the definition of dementia, the problems I have mentioned, it is so severe enough that it affects our day-to living, social and occupational functioning. And in MCI, the decline is there according to the patient's age and education, but it is not interfering with daily living. So it is basically pre-dementia, and the MCI patients worsen 10 to 15% every year, and over 5 to 6 years, a lot of these patients can develop full dementia. Now I'll discuss how frequent is dementia. The dementia patients are increasing around the world, especially in the Western world, and the underdeveloped countries or developing countries are also catching up because of the increased longevity. And in the world all over, sanitation has improved, nutrition has improved, living standard, and also the medical services. All this has improved the longevity of the patients. So the patients are living longer. And if you look at the frequency of dementia, 6 to 8% of the people above 65 can develop dementia. And if you look 60 to 64%, 1% have dementia, and it progresses with time. So if it is 30%, 90 to 94%, and people over 95 or above 40% people have dementia. So the longer we live, the more chance of having dementia. But it also can affect younger people in 30s or 40s, especially patients with Down syndrome. But mostly it is a disease of the older people. So let me discuss about the types of dementia. There are several types of dementia. Most important cause of dementia is Alzheimer's disease. It is 50% of all the total dementias. In Alzheimer's disease, there is atrophy or degeneration of the frontotemporoparital area, and it is of slow onset. It affects the aging population, and if you do the autopsy and brain biopsy, we'll find certain neuropathological changes which tells us that this is Alzheimer's. Especially the neuropathological changes will be neurofibrillary tangles, amyloid plaques, granulovacular degeneration, etc. And also biochemically there will be loss of acetylcholine production in certain portion of the brain. As because of this, patient will have memory impairment. Second most common is vascular dementia. It represents 25% patients of dementia, and vascular dementia occurs in those patients who have hypertension, diabetes, and these patients can have strokes, which can be big strokes, small lacunar strokes. Sometimes it can be silent stroke. Sometimes it can also cause subcortical extensive subcortical leukoencephalopathy, which is called Bischweinger's, and it has stepwise progression. Third most common cause is Lewy bodies dementia. It represents 15% of the dementia patients, and it is because of presence of Lewy bodies in certain portion of the brain. These patients have certain features. They can have some features of Parkinsonism. The dementia and Parkinsonism can start together, or the dementia occurs slightly later than the Parkinsonism symptom, and patients can have falls also. There is fluctuating level of consciousness, hallucinations, REM sleep disorders, and they are very sensitive to neuroleptic drugs. So Lewy bodies dementia is also one of the important reasons for dementia. And then we have the frontotemporal dementia, which represents 5%, and this kind of dementia patients have frontotemporal atrophy. And if you look at the autopsy and brain biopsy, they have specific Pick's disease, which is pathognomonic of Pick's type of dementia. And these patients, dementia is not important part of these patients. They mostly have behavioral changes, loss of inhibition, and apathy, which is part of the frontal lobe function, and they can also have language dysfunction. Then we have next category, which is called mixed dementia. Mixed dementia means they can have combination of different types of dementia. They can have Alzheimer's and vascular dementia, or Alzheimer's with Lewy bodies dementia, or different 2 or 3 combinations, and they are called mixed dementia. And Parkinson's patient also can have dementia as part of their non-motor symptoms. We all are aware of the fact that Parkinson's disease patient can have tremor, that is resting tremor, rigidity, bradykinesia, loss of postural reflex. And among the non-motor symptoms, later on, these patients also have dementia, which is of subcortical type. And again, we'll discuss about the treatable causes of dementia. Some of the patients with dementia have treatable cause, so certain deficiency state can cause dementia, like vitamin B12 deficiency, folate deficiency, or hypothyroidism can cause dementia. And some patients with syphilis also can have dementia. Syphilis is not as common as in the earlier days. And patient also can have space occupying lesion like brain tumor, which also can affect cognition. And normal pressure hydrocephalus also can cause dementia. And so there are different causes of dementia which are treatable. If the primary problem is solved, the memory or cognition is definitely improved. Again, there are different types of genetic causes of dementia, especially familial autosomal dominant Alzheimer's disease. As I mentioned earlier, dementia patients of Alzheimer's type, they are mostly old people, but sometimes young patients can have Alzheimer's disease, especially running in the family, especially preselin 1, 2, apoprotein E makes somebody to have Alzheimer's at younger age. So this can be tested to see whether patient has dementia in the early age, which can run in families. How we can diagnose dementia? Most important is history. So we take a comprehensive history from the patient as well as the observer or the person who lives with the patient, because they can give a better history. A lot of patients with dementia, they are not aware that they have some cognitive problem. So we have to ask a few selected questions, especially regarding attention and concentration ability, orientation to person, place and time, memory, which can be short term, long term. We also should ask about praxis, whether patient can dress himself, can lay a table, etc. We have to ask about the language function, whether patient can understand or whether patient can express. And we have to ask about higher executive function and also ability for problem solving. And we have to also ask about whether patient is having any psychiatric feature like depression, anxiety, psychotic symptoms, and whether patient is having any sleep disturbance. And we also have to review the medication patient is on, because a lot of medicine can cause confusion and restlessness, and also can impair memory, especially the benzodiazepine group of sedative drugs, neuroleptics, anti-epilepsy drug. All this should be checked whether patient is on any of this medicine. And we have to assess the patient's cognitive impairment through different screening for cognitive function. One is most important is mini mental status examination. We can do MOCA test and also the general practitioner assessment of cognition test. And we have to rule out the reversible causes of dementia for a proper diagnosis. And also how we do the investigations for diagnosing dementia. First, we have to do certain routine tests like CBC, ESR. Then we can check for the thyroid function test, VDRL if it is necessary. We can check for LFT, then renal function. We have to check for glucose, calcium level, and folate level. So these are important tests. And we can do the psychometric testing also, and neuroimaging is also important part of the test, like CT scan or MRI. By that we can see what part of the brain is affected, how much it is affected. Besides dementia, we can look for other causes which can cause dementia, like subdural hematoma, brain strokes, or brain tumor, or any infection of the brain. So the neuroimaging helps us to make a diagnosis. Sometimes rapidly progressive dementia, EEG is very helpful. Suppose SSP, Creutzfeldt-Jakob disease. So these few diseases or epilepsy underlying, these diseases can be sorted out through EEG. And neuropsychological test also very important to assess for dementia. Sometimes the dementia can be very complicated, and it is very difficult to differentiate between the different types of dementia, and it can be challenging to differentiate between Alzheimer's disease, vascular dementia, and frontotemporal dementia. In those cases, we can do SPECT, which is a single photon emission computerized tomography, and this is a specialized test which is available in our country. And sometimes we can do CSF study to look for chronic meningitis, like TB is very important in Bangladesh, and sometimes and rarely Creutzfeldt-Jakob disease also can be diagnosed. And sometimes genetic clinical genotype analysis can be done, which is more available in the Western world. Regarding the management of dementia, we can divide it into pharmacological treatment, non-pharmacological treatment. Pharmacological treatment, we can start with acetylcholine esterase inhibitors. These are of three types. One is the donepezil, galantamine, and rivastigmine. These are all FDA approved, and they can be started on a low dose and slowly build up the dose. We have to assess the patient periodically, what is the improvement. Before and initially, we should have the baseline cognitive evaluation, and with time we can see how much the improvement is there. And this medicine sometimes can cause liver dysfunction, so we have to check the liver function periodically. And this medicine helps in different ways. It improves in cognition, global function, and also behavioral symptoms. So it's very important medicine to improve these problems. And this medicine works in different kinds of dementia: Alzheimer's type, vascular dementia, Lewy bodies dementia, Parkinson's dementia. Only thing, it does not help, or rather worsens, patients with frontotemporal dementia. Again, there is another medicine which is called memantine, which is NMDA antagonist, which is a glutamate excitatory neurotransmitter. Memantine helps in moderate to severe dementia. The earlier I mentioned those three: donepezil, rivastigmine, galantamine works in mild to moderate dementia. Memantine works in moderate to severe dementia. And this medicine should be given for a long time, years together. When there is no benefit of applying this medicine, when the patient has very advanced dementia, non-communicative medicines are not helpful, slowly we can withdraw this medicine. Some patients with dementia, they can have also other associated problems like depression. So this depression should be treated especially with exercise, which are of different types. Tricyclic antidepressants are not very useful. Rather, it can cause different types of side effects. And sometimes these patients have behavioral disturbance, restlessness, agitation. So these symptoms should be treated with proper neuroleptic drugs. Especially the atypical neuroleptics are very helpful because it does not produce EPS, extrapyramidal side effect. There are different choices for treating this medicine, and we should not use benzodiazepines in these patients because it can worsen the cognitive part. And sometimes these patients become so much violent, aggressive, have severe sleep disturbance that they cannot be handled by the family members at home. So to improve these problems, these patients can be brought into the hospital for some time, and the symptoms which are distressing for the family should be managed, and then patient can be sent home. The patients of dementia in Bangladesh and other third world countries are mostly part of our family, our grandfather, grandmother, parents, or uncles or aunties, and they live with the family. But in the Western world, because the family ties are not as strong, a lot of these patients end up in the nursing homes where they get different types of services, good nursing home, medical care, etc. So once these patients have some medical problems like any kind of infection, sepsis, systemic or CNS infection, electrolyte imbalance, or confusion, sometimes it is very difficult to diagnose these patients because they cannot complain, they cannot express their distress or problem. So these patients should be brought into the hospital, have a thorough evaluation, and the problem should be addressed properly. Even some electrolyte imbalance, hyponatremia, or liver dysfunction, kidney dysfunction, systemic infection like UTI, pneumonia, infection of the bed sore, all this can cause problem with these patients, which can only be diagnosed properly in the hospital and treated properly. The important issue with these patients are cannot take food properly, so these patients should have nutritional status properly addressed, and they should not be dehydrated. So adequate nutrition and fluid balance are also important. The demented patients, over time, they also lose other function besides their cognition. So they have slowly progression of their motor dysfunction, and they cannot walk properly. They have stiffness in the limbs. Finally, they become bedridden, and they have problem with urine control, urinary incontinence, bowel incontinence. So ultimately, these patients become bedridden. They cannot take care of themselves and become total care patient. Even they cannot take food orally. So these patients have to be fed through NG tube initially, and in the long run, if the NG tube cannot be taken out, the choice of esophageal gastrostomy, that is PEG tube, should be entertained, which helps in better feeding. And when the patient becomes bedridden, the chance of bed sores are there. So proper physiotherapy, bedside physiotherapy, if necessary, chest physiotherapy should be given. So in the long run, these patients have loss of cognition to severe extent. They cannot communicate, they cannot understand, they cannot express any words or very few words, and finally they become mute or non-communicative completely. So over time, these patients can have problems which should be addressed properly. So the dementia medicine in the long run does not work as much. So these patients should be properly nursed, and medical treatment should be continued. If there is any complication, they can brought to the hospital. Lot of times they develop infection and pneumonia because of aspiration, which is a deadly complication. And we also have to think of palliative and end of care of these patients, because advanced directive should be thought of by the family members, because they cannot decide how much treatment these patients will be given in the hospital, and if necessary DNR, that is do not resuscitate orders, should be thought of or addressed. So this is a brief description of patients with dementia. This is increasing all over the world, and also the number of patients with dementia are increasing in the developing countries. So we should be very well aware of this problem. There are new therapies which are being under research in the America, Europe. Nothing has been fruitful so far. Lot of therapies, including vaccinations, are also being tried. So we are not sure when it will be successful or come out, but we have to continue our treatment. Thank you for your attention. Hopefully this will be very helpful for the patient and the doctors.